Hi there, my channel of Lumiere Skin and Spa. Welcome to 360 Anti-Aging TV. Last week, we talked about collagen and how it makes up about 70% of your skin's volume, and how, with the reduction of collagen as we age, skin begins to sag and wrinkle. At the end of that video, I showed you the different lasers, mechanical and energy devices that I use in order to reverse skin aging and build collagen for my clients. If you haven't already, I would suggest you watch that video, and I'm going to be sending a link on the show notes below. Before we get on with today's topic, I would like to give a special shout out to one of our early subscribers. She and her fiance have been watching this channel for health, fitness, and anti-aging tips, and I want you to know I super do appreciate the support. And it also happens to be her birthday on May 13th. So happy birthday, Miss Jess Kang. As a token of my appreciation and well wishes, I'm going to be sending you a Skin Renew set from Lumiere. I hope you enjoy using the product, and please do let me know if you like it. If you want to be the next subscriber of the week, all you have to do is subscribe to my channel and leave a comment below letting us know that you want to be the next subscriber of the week, and we'll take it from there. Today I'm going to be featuring one of my favorite devices to use for skin remodeling, and that is the Enerjet 2.0 by Perf Action. Now, the Enerjet does many things that are beneficial to the human skin. Among them are acne scar remodeling, stretch marks revision, lifting of sagging skin, and the reductions of fine lines and wrinkles. Does it work? Absolutely. Is it safe? In the hands of a professional or somebody who knows what he or she is doing? Yes, very much so. And to demonstrate this, I actually did the treatment on myself. That's right. I'm shooting today on May 12th, 2020. And I did the procedure on myself last May 7, 2020. And what you're seeing right now is the end result barely 5 days after the initial treatment. I have to warn you guys that this video might be a bit graphic. Because of the nature of the treatment, it will look like I have been stung by a swarm of bees immediately after the procedure. So if you're queasy, this video might not be for you. But the good news is, the swelling and the blebbing really only lasts for a few hours, and by the following day, you're well on your way to having your normal appearance back. And I predicted this, and I said this immediately after the treatment was done on me. And the reason why I know is because I've had this treatment done once before. So what I want to do is show you what I look like immediately after the procedure before showing you the actual procedure. Have a look. All right, guys, so this is what it looks like immediately after the procedure. I'm going to go up close, and you can see it does look really bad. It does look pretty bad, but the good news is this is going to be, all that blebbing is going to disappear after a couple of hours, right? So in a few hours, all that swelling is going to subside, and I'm going to be left with some scabs, which are going to fall off in a few days. And that's about the only downtime. Okay, so now that you've seen how scary you're going to look right after the procedure, the next question that begs to be answered is it worth it? Now, aside from the minimal pain and minimal downtime, there is also the cost to consider. The treatment cost is anywhere between 25 to 45,000 pesos per treatment, depending on the amount of area we have to cover. And depending on your present skin condition, multiple treatments might be required. For me, the answer is a definite yes. Why? Because barely 5 days after the treatment, I can already notice and see the tightening around my forehead and eye area. I can literally feel the scalp being pulled back. But what is most really dramatic for me is that after only 5 days, I can already see a noticeable improvement in my nasolabial folds or laugh lines. Now, keep in mind that this is only 5 days after the treatment, and collagen remodeling doesn't really usually become noticeable until after the 21st day. So, it might be a bit hard for you to see what I see simply because even at 50, thankfully, I have very minimal sagging and wrinkling on my skin. But I do know where my wrinkles and weak spots are, and I can say with all honesty, I have seen a very visible improvement. During the actual procedure, I'm going to be explaining to you how the machine does what it does. And so without further ado, here is my procedure using the Enerjet 2.0. All right, so on the previous video, we spoke about the different methods we use at Lumiere to rebuild collagen or to induce neocollagenesis or collagen remodeling. And why do we do that? Because as we age, the collagen that we have begins to thin. And when that happens, you start to develop wrinkles and sagging. So today we're going to be doing a procedure called the Enerjet. And what this machine does is it uses hyaluronic acid or natural fillers. These are molecules that are hydrophilic to break down existing collagen and at the same time thicken the skin. So the procedure is called dermal thickening. Why do we want to do that? This will help to reduce fine lines and wrinkles. And not only that, the machine is deep enough to hit the S-mass or the superficial musculo-aponeurotic system. These are the tendons and the muscles that hold up the skin. So if I were to treat certain areas here just above the hairline and here, this will actually pull up the skin and the eye area like so. And today what we're going to be doing is we're going to treat the nasolabial folds as well. And we're also going to hit the jaw area to pull the whole face back up. So it's going to go through the forehead, the hairline, and then back here. Back here. And this is more or less the treatment that we're going to use. This is called the kinetic facelift. So we're going to be doing the procedure. We're going to be showing you how it's done. And see you guys in a bit. All right, so we're right about ready to start. Before we do any procedure, obviously, the face has to be cleaned. So Pauline here. Pauline, say hi. Hi, pretty Pauline. She's going to be washing my face. And now at least you know, I've shown you the demarcation line where Pauline is going to be doing the treatments. Now keep in mind, the Enerjet does two things really, really well. Number one is it's an excellent way to lift the face non-surgically. So when you would go for a facelift, a surgical facelift, they would normally, the surgeon would normally pull up the S-mass because pulling that up will affect the dermal and the muscular structure of the face, pulling the face like so. And we're going to try to achieve something similar without having to cut you open. We're actually going to be using pneumatic pressure and fillers to target certain areas of the S-mass and pull those up. The second thing that the Enerjet is really, really good at doing is dermal thickening. So as we age, the skin begins to thin because collagen begins to degrade. Remember, the skin, the dermis in particular, is made up of almost 70% collagen. And when you lose collagen as you age, the skin begins to thin. That's why you see the wrinkles. And we're going to be hitting certain areas like the nasolabial folds and the area outside the orbital rim where the crow's feet usually form. And if we have some fillers left, we're going to hit the forehead as well. And I'm going to be showing you a before and after picture after a couple of weeks. So we're going to do a couple of follow-ups. But for now, I'm going to let Pauline clean my face, and I'm going to leave the camera on so you can see what's going on. Okay, just a word of warning, guys. The video you're going to see is a bit graphic. The way the Enerjet works is, like I said, by using air pressure or pneumatic pressure to sort of shotgun thick dermal fillers inside the skin. So the resulting trauma will cause the skin to actually bleb, right? So it's going to look like you've been stung multiple times by bees. So expect that. And one thing that clients are actually curious about with this procedure is, will it hurt? All right? And this is my second time to do it, and I can tell you quite candidly that it's actually very painless. Why? Because the fillers that we use actually, right, already contain lidocaine. So lidocaine is an anesthetic, so you'll barely feel anything. It's going to look much worse than it actually feels. Okay, ready? So we're going to be starting with treating, yes, the forehead and just above the hairline. This is going to pull the scalp back. Ready? So the treatment is kind of loud, but it's really practically painless. Kita ba yung blebbing?
May video naman ako. Meron ako nakita.
So I'm not sure if you can see the blebbing, but we're just going to continue on. When we hit the open skin, then that's where you're going to see the effect. So we start here. Pag ganyan. Right? Etong dalawang area muna.
Side ka, so.
Right? Right.
Wait.
So you can see where we're hitting. There is some superficial bleeding, but again, it's really looks a lot more painful. I hardly feel anything. It barely feels like ant bites. We do another line here. Yeah.
Side po.
Three rows, yan. And then let's do the jaw area. siya. You see? Right there. And next, we're going to go into the nasolabial folds. So just a word of warning, the nasolabial area is actually quite sensitive, so you can feel it a bit in this area, but it's not really that painful. Okay, gosh. So I sort of felt that one. Now, you can see it does look like I have been stung multiple times by bees, and I'm trying to decide if we should go ahead and do the forehead area. How many shots do we still have? Oh, okay, sige. So we might as well do the forehead areas. I just have some shots left. Yung mga lines, yung mga area na lang na may lines, that wrinkling. So one thing to watch out for, there might be a bit of bleeding in the targeted areas, but just so you guys know, that is actually what we're looking for. Assuming you are not using artificial blood thinners, right? Early bleeding is a good sign that the vascular system on the skin is still working properly. So you want the bleeding because the bleeding will stimulate the healing. It will stimulate earlier healing. All right, guys, so this is what it looks like immediately after the procedure. I'm gonna go up close and you can see it does look really bad. It does look pretty bad, but the good news is this is going to be, all that blebbing is going to disappear after a couple of hours, right? So in a few hours, all that swelling is going to subside, and I'm going to be left with some scabs, which are going to fall off in a few days. And that's about the only downtime. The good news is you're going to begin to see collagen remodeling almost immediately. Within 48 hours, I would usually see some sort of a lift already apparent. And this is going to go on, especially when you hit the 21-day mark. Collagen is really going to remodel, and you're going to see a very good rejuvenating effect. So I'm going to take another picture after 3 weeks, just so you can compare. Just so you know, the Enerjet can also be used for a couple of other procedures. Number one is it can be used to treat stretch marks. We're actually going to be doing a video later on with my wife, so you can see how we treat stretch marks. And this is also an excellent treatment for revising acne scarring. So if you have acne scarring, that is collagen that did not form properly during the healing process. And what the Enerjet does is it breaks down the collagen again to force the body to trigger more collagen production. The reason why the scars remain submerged is because collagen formation did not occur the way it should. This is actually a bit common in brown skin types, types 3 and types 4. My wife is Filipina, so she has type 4 skin, and she has just a bit of acne scarring on her cheeks that we're going to be treating, and I'm going to be showing you that as well. All right, so thanks for watching. I'll see you guys after 21 days. So there you have it, my kinetic lift from Enerjet 2.0, only at Lumiere Skin and Spa. If you want to schedule an appointment, or if you have any questions, feel free to visit us on our website, www.lumiereskinandspa.com, or visit us on our social media pages, Lumiere Skin and Spa, on Facebook and Instagram. Now, before I end this video, I'd like to stress one thing. Clients often ask me, what do I use in order to maintain great looking skin? And I always tell them, I use the same machines I recommend that you use. The only difference is my lifestyle is probably much different than yours. Remember, it's not enough to treat extrinsic aging or external signs of aging. But if you truly want to reverse aging, you have to slow down or reverse intrinsic aging, or the rate at which you biologically age. If you want to know more, this is exactly what the 360 Anti-Aging program is all about. You can subscribe to my channel and click the notification bell so that you'll be informed every time I have a new video out on this subject. As always, please remember that if you are not aging deliberately, chances are you're not aging well. Until next time, to your looks and good health, this has been Mike Chan.